tonight we are very happy to introduce Jessica. Jessica, where are you? I had to pull you up. There you are. Jessica Streufert is a respiratory specialist. She is one of the people doing, like so many respiratory specialists right now, getting hit up with questions day after day after day about the lungs. And so, although we might not hit you up with questions about COVID immediately, I think you said you welcome those kind of questions, but we are here to talk about cannabis. So thanks for being here. Could you tell us a little bit more about you? I just gave a thumbnail.
Yeah, no worries. Thanks for having me. So yeah, I'm a respiratory therapist or respiratory care practitioner, depending on what you hear in the news, but respiratory therapist is general. So I've done that for about 21 years in the hospital setting, in the ER and the ICU. And essentially a big part of my job is intubating, or if you hear people talk about putting a breathing tube down somebody's throat to help them breathe and put them on a ventilator. And in doing that over 21 years, no matter what you do, where you put a patient's bed, you have to bend. And in that process of 21 years, I tore my discs. And so about, 6 or 7 years ago, they put me on steroids and PT and all these other kinds of medications. And then you can't work in the hospital on all those kinds of medications. Some that basically the opioids and whatnot, I couldn't go to an emergency and help resuscitate a patient on those meds. So I actually, associates or friends that Trey and I both know, that said, why don't you try something called CBD? And being in the hospital, even though I'm with Western medicine, I've always been pro cannabis. I never really did cannabis. I wasn't against it, but I didn't know enough about it. And so I went ahead and tried CBD, and it was immediately my back started feeling better. I came off prednisone and multiple other things, but in doing that, I discovered this whole new world of more than just THC or people getting stoned that came in, that I saw. So kind of delved myself into learning everything I can about the science of cannabis and the endocannabinoid system and terpenes and different cannabinoid profiles, and how can I give this or help my patients? Well, as I heard somebody in here is going through veterinary school, you're not allowed to talk about cannabis, period, in the hospital setting. You have to be off the property. You can't mention it. You can't even say, I'm not against it. You can't say anything else. I would lose my license to practice. So essentially kind of weaned myself out of the hospital and into retirement in a way. And between a little burnout and the stress of working in all the ER, I started working with somebody named Mary Brown, who a lot of you may know, and I started working with SMJ Consulting and started going and speaking to other doctors and teaching them about how cannabis works and how they can incorporate it into their patients, and to not be afraid of it and not have that stigma. And then hearing it from a respiratory therapist where, they hear the stigma and they think, well, if you inhale cannabis, you're automatically going to get emphysema and whatnot and cancer. So I really had to dive into, explain to them with my experience of cardiopulmonary specialist as a respiratory therapist, how that it's safe to use if used in the proper way, and educate them to make it more well known in the medical field as well. So that's a big part of what I do. And then Mary and I work with at the Ames Institute, and so I'm now basically a cannabinoid therapist. I help patients with cannabis and guiding them on how to use the proper cannabinoid profiles and terpenes and modalities to best help with whichever ailment they're currently in.
That's great. And so I've been fascinated by what you do on a couple levels, because we got to teach together to a group of cannabis professionals and entry level to professional, longtime professional people, and to see somebody who specializes in the lungs and who should be most concerned about damaging the lungs, to really not have an aggressive position toward cannabis. I was fascinated. So but to sit through Jessica's session, we really got inspired, and we're like, how can we bring this to more people? And that was the inspiration for the creation of a pulmonary dynamics class, which is a term that you taught me. And but it's about vaping versus smoking. And I know when I first heard you speak, you said a lot of times you could tell who a cannabis user was without them telling you, because oftentimes they wouldn't tell you the truth anyway.
No.
Tell us about that and how you could tell.
Well, so in the hospital, as a respiratory therapist, a big part of our job is we have open heart patients. So we would go and pre-op them, but you kind of you're telling them about when they wake up, they're going to be on a ventilator. I'm going to be the first face you see when you wake up, and I'm going to be screaming at you to take in these big, deep breaths. And I'm going to want you to cough because I want to pull you off the ventilator or life support, whatever you want to call it. And so, and to do that, we give them this thing called, it's called an incentive spirometer. Basically, it looks like a big straw that you suck in and the ball moves. But in doing that, it gives me the full volume in your lungs called vital capacity. And it's a technique, but it's when they take in these big, deep breaths, and it's, you just know between a smoker, a regular person, and a cannabis, smoker, they can barely get the ball to move and their volume's really low. A normal person, you see this slow kind of a deep breath, but they're not really hitting it. And then when I get to a cannabis person, it's a big deep, and I'm like, oh yeah, oh, we know. And it's just an, I don't want to say inside joke, but we all know who was, and I'll ask, okay, do you happen, they don't want to tell me they smoke anything at all because I'm a respiratory therapist and I may lecture them. But that's not it. It's all technique, and they learn that deep breath and getting that full vital capacity by when they're smoking cannabis, because they're trying to get down to the bottom of their lungs. So they're already a professional at this incentive spirometry.
So a myth that you dispelled for me early on is one is when we were taught as young people, or we taught ourselves to smoke cannabis, it was all about taking a deep breath and then holding it as long as you could, because cannabis was expensive and you didn't always have it, and you wanted to make the best of every experience. You don't want to lose any. And then finally, people there were almost like contests who could hold their breath the longest. Yeah. Tell me about that. Does it help?
No, that does not help. So technique is key. If you really want to get the best out of your cannabis, it really is, and we'll get into temperature later, but temp is really key in this as well for your terpenes. But it's like teaching somebody how to do their inhaler correctly, or an asthmatic how to use their MDI. It's taking a nice, slow, deep breath where you're inhaling through your belly button, not your chest. Because when you do that or too fast, you're actually cutting off your lower lobe. So you're not even hitting the bases and not getting your full vital capacity when you breathe in. So it's a nice, slow, deep breath into your belly button. Kind of people who do yoga would know that best practice, but 3-second max hold. And here's why. Because when you inhale, as you're with your lungs, so when you think of the grapes or the sacs or alveoli, people like to think of a tree and the grapes come on. So those little sacs fill with the air. And as they're filled, that oxygen or cannabis that you just inhaled has to cross over the membranes, these capillaries. But when that happens, the blood in those capillaries has to offload CO2. That's how our body works. The hemoglobin that comes back has to exchange CO2 out of your lungs. So as after your 3 seconds, that CO2 is going to force its way back across. And if you're still holding your breath, there's this barrier pressure. It's called intrathoracic pressure, but it is holding the CO2 pushing against that cannabis. So the cannabis is no longer going to cross that membrane. It's not going to get to the blood. It's not going to get to your brain. It's just sitting there, and it's going to actually increase barotrauma, and it's all going to come out eventually anyhow. So no, 3 seconds, max hold, wait 10 minutes, and then go again. Yeah.
Wow. So that was mind blowing. That was the first one, because certainly not what I learned, or, because what I learned was from, my fellow teenager that knew it on great authority that that's the way it worked. And then as we know, folklore holds on, people believe. Also people say, used to say, what, the more you cough, the more you get off. You've heard this?
Yeah. And that's not true either, because when you cough, you actually cut off your lungs. So if you cough, you're actually forcing air out of your lungs, but so the lungs come down. On the left side, you got 2 big lobes, and on the right, you got 3. When you cough, you cut everything off below the top lobe. So nothing's getting down to the bases. And then again, you have that CO2 trying to push up against the cough. And what actually happens is people will tell me, well, no, that's when I get the tingles. I'm like, no, that's just an hypoxic event, because you coughed, and it causes a bronchospasm, which then lowers your oxygenation. So that's where the cough comes in, but it does make you feel tingly. And that's because of the CO2 and oxygen differential.
But kind of like holding your breath makes you lightheaded too, right?
Yeah. Is the same
That's what you're saying. Yeah.
It's building up your CO2. And if you have too much CO2, you get lightheaded. So it's actually your CO2 causing the feeling and the lack of oxygen, not the cannabis.
So maybe basic lessons, but I want to make sure we dispel the basic ones straight off the bat. So talk to me. You said terpenes, and terpenes, that word should light up people's brains, we hope. So if you're a student with us and you're new and you don't know what a terpene is everything you smell in nature. It's pine needles, it's mangoes, it's lemons, it's pepper, it's cloves, it's all these things. And cannabis has all of those things too, but in a bouquet. So it will have some limonene, like you smell in a lemon. It'll have some beta-caryophyllene, like you'd smell in cloves, and it has some myrcene, like you might smell in mangoes. But it's all intricately blended. So that's why your Panama Red smells like Panama Red, and your Afghan Kush smells like Afghan Kush. And so terpenes, we're finding out, are increasingly finding out, are therapeutic in nature. And our aromatherapists have said this for a long time, but the terpenes are where it's at for a lot of people. And if you destroy the terpenes in your processing, in your consumption method, then you're losing a lot. And so talk to us about how would you have us preserve terpenes, and how does that also have another beneficial effect?
So terpenes, and again, as a respiratory therapist, I'm thinking of benefits to my patient, what's going to benefit their body. So apinine, that's the pine needle one. That's a bronchodilator. That helps your lungs. So my asthmatics who come to me, maybe they have anxiety. Well, apinine is not also a bronchodilator. It helps decrease your anxiety. So does CBD is also a bronchodilator. So inhaling these is also helping your lungs. But to me, the terpenes, as Trey, you and I know, boost the effects of the cannabinoids. So it's not just about your CBD, your THC, your CBG, your CBN, your CBC, or your terpenes. It's the combination. This is where you get to the entourage effect. It's all about them as a whole, where you need less. You can microdose and get a stronger boost with these terpenes added in. So, people will come in to the clinic. A patient will come in and, for a cannabinoid consult, and they'll say, I've been smoking forever. And, and I'm like, okay, well, what do you, and I, my ask is, what chemovar are you smoking? Because that gives me an idea of what's the full picture is. What are my terpenes in there? Because terpenes to me are key in helping treat the patient just as much as the cannabinoids. So when they tell me, and I said, well, how are you smoking it? What's your modality? And then they'll tell me they're lighting it up and smoking. I'm like, okay, so we're not controlling temperatures here. We're not, and they complain to me that it's not helping their back pain or their anxiety. I'm like, well, all you're getting from your modality because of temperature, you burned off those terpenes. They're very fragile. They have low boiling points. So we got to preserve those terpenes. And when I can teach them that in a device, whether it's, they can control the temperature. I still, smoking flower, a vaporizer, but controlling their temperature and keeping it below 380. And then they take that and they actually can taste and smell the terpenes. And they don't have to they're not constantly smoking throughout the night. They can actually monitor their dosing, find a specific dosing, and get the effects that they're needing for their body or their anxiety or their pain. And it's those terpenes that are help boosting the effects of that THC and CBD. So it makes a big difference knowing your different terpenes and how they relate to your body and different ailments.
And so that's a critical thing to understand. And so if only way you've ever consumed cannabis is by smoking it, then I highly recommend you try vaping it, and not just vaping carts, which I'm not against, and we have, and that sort of thing, but smoking fresh or vaping fresh flower, fresh ground flower. And anytime you're working with concentrates, you want to make sure the purity is there, because otherwise you're concentrating pesticides and heavy metals and everything too.
Carcinogens.
So it's real important to pay attention to your labels, know that, make sure your stuff is pesticide tested. In Washington State, it is not required to be pesticide tested. Mind-blowing. But there are only 3 companies in our state, 3 licensees that are allowed to sell to the medical community. So pay attention to those, because they're getting tested for heavy metals. Likewise in Nevada, pay attention to your testing. Who's done the testing? Don't take that label for granted. But like you said, vaping it and keeping it low. So even with these pens, it's usually got a green, a blue, a green, then a red cycle.
Orange,
with the blue being the lowest often. So if you find out that these little things or other, even a volcano really tears up your throat,
too
it
high
may
temp.
be all about temperature. And I know you have lectured me on this before,
Yeah.
gently and with love. But
Always with love.
but to turn the temperature down, and man,
Yes.
the flavor is
Mm-hmm.
so much better. The cart will last longer.
Mm-hmm.
And more importantly, you don't have that, you don't feel like you've been swallowing gravel or whatever that, that you
Well,
get that persistent cough.
you're increasing inflammation and you're causing bronchitis because you have to think your lungs, your inside your throat and your lungs, they're your core body temperature. When we're born, we breathe through our noses. That's how you're supposed to breathe, is through your nose. You're not technically supposed to breathe through your mouth, but we get older, we talk a lot, we eat, we get lazy, we breathe through our mouth. Your nose actually has a filtration system. So it actually humidifies your air as you breathe it in. You don't want dry air and you don't want hot or cold air. Like if somebody's running in the really cold air, they notice it's a little harder to breathe because that cold air constricts the lungs because the lungs don't like that cold. Well, it's the same with the heat. If you're around, say you're around a campfire and that smoke's blowing in your face and you can't breathe and you're coughing and the next morning you got some congestion, that's because that smoke and that heat irritated your lungs. They like a set humidified temperature. Your lungs are coated with mucus. So it's kind of think of like they're DW40'd up. They have to stay lubricated. And that mucus is not only to make sure your lungs don't collapse because they're very, very fine, the alveoli. And if they close, when you exhale, they'll stick and then they rip and you get a pneumothorax. So they have this mucus all over, but in that mucus, they have the little hairs, the little cilia, which I called my little janitors, my little brooms, sweeping constantly all over, but they die if it gets too hot. So campfire smoke, that kills them. One puff of a cigarette kills them for 20 minutes. So if somebody's a major smoker, a lot of my COPDers and my lungers, they quit smoking. They're like, I got the worst. I got so sick, coughing all this stuff up. That's because the cilia will rejuvenate. But if they've been smoking for so many years, those cilia are dead. So secretions are building up and they're getting infected. And so I think I mentioned this to you before, I would suction. I would stick a catheter down and suck out their lungs and I get black crap and all this other yellow, black, green stuff. And it's from the tar in the lungs because nothing has been cleaning them out. That mucus has just been building up and getting infected and you get pneumonia and bronchitis. But the cilia, if they're not being burnt out, they're constantly cleaning out your lungs. So you don't even notice it, is that you actually swallow any secretions that are constantly coming up. So increased temperature, too hot. Like I said, don't go above 380. Get a flower vaporizer, get a good product, use that. Keep your temps below 380. You still get the effects because you get the terpene. You still get a nice dose. It's all about your technique of inhalation and don't hold over that 3 seconds. But if you can keep your temp control, you'll notice your throat doesn't burn anymore. You're not coughing the next day because your cilia are staying alive and they're keeping your lungs cleaned out, and filtrations. So going back to those smokers, it takes 3 months. If somebody quits smoking, I say, get through those 3 months. You're going to be sicker than crap. You're going to be coughing stuff up you never imagined. But if you can get past that 3 months, your cilia will be rejuvenated and then you're good to go.
Okay. Did I mute? Oh, okay. Let me ask you this. Cancer, because people who don't know or just naturally look like a joint, looks like a cigarette. How can cigarettes definitively cause cancer and you're not worried about a joint? Talk to us about that a little bit.
Okay. So cigarettes have nicotine. They have all kinds of things in there, but we know the nicotine, first of all, is the big carcinogen. Those are cancer causing. Cigarettes, everything in it, they got formaldehyde in them. I mean, they have everything that is literally poisoning your body from the inside out. But the combustibles, they're heated up, like we're just talking about temperatures, those are carcinogens. When you talk about cannabis, so if you're being temperature safe, even if you're not being temperature safe and you're smoking constantly, you are going to probably get bronchitis. You may get a pneumonitis, and that's just because of the inflammation and the irritation in your lungs from the heat and killing your cilia. So you'll have that secretion production, which because the heat activates the goblet cells, and those are what produce secretions in your lungs. So you may get that. However, we know that THC and the rest of the cannabinoids, and again, there's over 160 different cannabinoids in the cannabis plant. Many we don't fully know, but they prevent the cancer from kicking in. They stop a certain enzyme that would normally cause cancer. So they are actually reducing your risk of cancer. And there's a good study by Donald Tashkin. He was a pulmonologist at UCLA. I think it was 2003, 2004 was the first big study, and he shows a big comparison on cancer with cigarettes versus cannabis. And yes, again, like you said, you may get a disease process of bronchitis or pneumonitis, but you're not going to get cancer because of the cannabinoids benefit in decreasing your risk of cancer and actually helping prevent tumor production. So that's the big point. But he's always the one I point out because he was a skeptic. So I like to throw him out there.
No, absolutely. And I followed up on that research because of you. And we would encourage people to do the same. So if you're in the pulmonary, I don't know if people in the pulmonary dynamic class are on tonight, but that's certainly in your course material. But Donald Tashkin, do check it out if you have any questions. And people are, I think people are right to ask those questions. I clean out a bong and I get disgusted. I'm like, oh my gosh, how is this not bad for me? And to be clear, you're not saying it's not bad for you, but you're saying it doesn't cause cancer because all that junk is still going into my lungs. So, but I have also heard you say, go ahead.
Yeah, I was gonna say, and that's temperature key and cleanliness and a good product. I mean, that really is it. Is keeping the temp down, making sure your bong or vaporizer is cleaned. That's whether it's white distilled vinegar, whatever you're using to clean it, make sure it's clean around, because then that cannabis plant, if you have a good plant and a good product, you're going to benefit your lungs, bronchodilation, vasodilation, tumor, it's going to stop metastasis. I mean, I give my lung cancer patients cannabis to smoke to help prevent metastasization of their tumors.
And so, so when you hear about cannabis being an anti-proliferative, that's what they mean is it kills some tumors or prevents some tumors from growing. So the cancer question is always good to explore, but want to make sure we went there. You also mentioned earlier about alpha pinene, and people might not realize that, the idea of cannabis for medical patients goes way back, like over 100 years ago, when they used to give asthmatics cannabis to smoke. And that's because of that very thing. Is if you've ever gone out to the mountains and you get out of your car and you take that big deep breath and you're like, oh, I feel like I can breathe here. You can, and it's the alpha pinene in the air, and you can get the same effect, maybe not as profound, but from an alpha pinene dominant type of cultivar. And so that was one of the first medical uses in Western medicine anyway for cannabis. And so it seems counterintuitive, but
yeah, it's not a rescue inhaler. If you're going into full on attack, it's not going to stop you. However, think of it as a preventive. I think I've told you this before. I had a patient who had kidney cancer, and he was taking CBD and a certain chemovar that had apinene in it with high CBD strain. And he was a lunger. He had 4 liters of oxygen. He'd been on for 10 years. We were dealing with the cancer, but the side effects, you want to call it, is he came off of his oxygen because of the effects the cannabis had on his lungs was positive, even though we were dealing with the kidney cancer. So happy side effects is what I call them.
No, like happy plant, happy trees. So, and I've also heard you say, and forgive me for paraphrasing you so much, but the difference is also volume or frequency, because a cigarette smoker could put back 20 cigarettes in a day, but likely people smoking joints even are not putting away 20 joints a day.
No.
And I would argue if you're putting away 20 joints a day, it might be time to reset your endocannabinoid system by just taking a little break. Because if you don't know, about 2 weeks off and your endocannabinoid system will reset and you become a cheaper date for yourself. Like it doesn't take as much for you to get the same effect. You do reset. Exactly. And so, so know that, but I thought it was the frequency thing was important to.
Yeah, frequency is huge. And if you're doing it right, and I have a lot of patients, I have them do different modalities just to get through the day, to get the full benefit and effect or longevity they need without having to smoke all day. So say maybe I have them smoke right in the morning, get that in, whether it's pain, anxiety, whatever we're dealing with, and then do an oral, whether it's a tincture or a capsule, to get that longer duration during the day. Maybe they have to work, they can't be smoking at work, they can get that for the day, and then at night they can go back to smoking something to relax and taking something else to get them through sleep, another capsule or tincture. So switching up your modalities or creating a full-on regimen to get the best longevity and out of your cannabis as well.
And I've heard your advice to, I don't know if it was somebody asked, well, what about us bong smokers? And you said, put ice in your bong, make sure to bring down the temperature however you can.
Yeah.
And so,
Yeah.
so,
Just bring down the temp.
and that's key. And it really, it's made concentrates more pleasurable for me, honestly,
Yeah.
because I wasn't paying attention to temperature. And it's made a world of difference. So
Yeah, that's a huge thing with people who are vaping from a vape pen and say it's not a controlled temperature, or they just don't, and they just go to the highest temp thing and I'm going to get the best hit off that.
right.
Well, and then they start coughing. That temp was too high. You actually burned your lungs. You injured your lungs. Celia just died and went, nope, we're done. So you're not actually even you may get a high dose from that, but you hurt more. Your chest hurts, you're coughing. Sometimes you get a headache with it. So yeah, just bring that temp down. You get a nice smooth, get those terpenes, and it's a more enjoyable experience.
Cool. Well, I want to make sure to open the floor. I know other people probably have questions besides me running off at the mouth. So y'all are welcome to raise your hand or just speak up if you have a question. You can unmute yourself. And if you don't, I'm going to jump back in.
I guess in conclusion, the best way of ingesting cannabis would be through smoking, would be through a bong or through the vape pen.
So my most favored way, I tell all my patients, is if you can get a flower vaporizer. So and they're a little spendy, but it's a vaporizer. You actually buy the flower and put in, and you can control the temperature. That, I think, you get the most longevity and the best out of the cannabinoids or out of that chemovar. Next, I go to vaping with a pen, but again, how Trey had that one that had the 3 different temperatures. That's my second choice, is do that, because you still can control the temperature. If you don't have those, use the bong, but try to put some ice in there to bring that temperature down. So you're really preserving the terpenes and you want to get the best out of your plant or whatever you have. You want to get the full potential out of it. Then you want to keep it at a low temperature to really get the terpenes. It can make that THC last longer and even more potent if you're getting the benefit of the terpenes in there and controlling that temperature. So my favorite is the flower vaporizer.
And we know from research that if you vaporize flower rather than smoke flower, your body consumes or is able to absorb a much higher percentage of the cannabinoids than you were, because you're burning a lot of them off, and what you do to terpenes, as you mentioned. So really, I know how it is. We smoke a lot of flower, and so when you get used to that taste and that effect and that immediacy, vaping can kind of be a creeper. You're like, oh, I don't know if it's doing anything, and then it hits you. So you really got to get used to it, but nothing like the flavor, really.
Yeah, and the other thing is, if you are going to smoke, remember, you're not going to get the duration you could out of a capsule or a tincture. So if it's somebody who has to go to work, or it's one of my patients is a mom and they got kids during the day, so they, for that immediate hit or whatever, even if it's not a THC, it's a CBD, they'll do the vape or the flower atomizer, and then they'll go and do the tincture, because the tincture will kick in about 20 minutes, or they'll take a capsule that will kick in about an hour, but that capsule will last 8 hours. So they're getting that longevity out of the product and still getting the benefit, to where if you smoke, you may have to do it every 3 hours to keep up the consistency of the benefits. So switch up your modalities and mix them up together.
Yeah, kind of like cross training, right? Just like your way your muscles respond differently. Kind of keeps your body on its toes of sorts, I guess. Yeah. Somebody asked for the pulmonary study. This is one of them. I know Donald Tashkin has several. Yeah. This is the one where he actually talks about the effects of cannabis on the lungs. So it's maybe more generalized. But if y'all look him up, and if you should be aware of PubMed, but PubMed is a great way, as is Google Scholar, to find a lot of stuff that's free. Sometimes it's a little brainy, but you can skip ahead to the summary.
Yeah.
I'm sorry, is that the one about how the cannabinoids kill the carcinogens?
How the cannabinoids kill the carcinogens?
Yeah, is this that exact journal, or is that a different?
I don't know if this is the exact. I know in one study, they showed that, of course, people that smoked cannabis versus people that smoked cancer, there was a higher incidence of cancer in the people who smoked cannabis. But then people who smoked both, there was a lower incidence of cancer if you smoked both as opposed to just tobacco.
So yeah,
Thank
so
you.
the
I
one
don't
in
know if that's that study though.
yeah, the one in 2003 or 2004, that's the one that gives you a comparison of cigarette or tobacco smoke versus cannabis smoke, and it compares just tobacco, just cannabis, or the both. And then it also gives you how that relates to cancer, COPD, emphysema, and bronchitis. So it breaks it down into all the different pulmonary diseases and cancer. But he all comes back to cannabis is not causing cancer. And in fact, it's actually helping you. It showed, I believe it was, I don't remember the numbers, Trey, but it was if a non-smoker was similar to a cannabis smoker in their pulmonary compliance and cancer risk.
And here's the study. I'm just posting it. It's called New Data Finds No Lung Cancer Link for Marijuana, as they like to call it. So there we go. So yeah, if you want to follow up on that, and it'll give you kind of a jump start into the world of Donald Tashkin.
Yeah.
Thank you.
Absolutely.
I had a question, Trey. So you're mentioning flower, you're mentioning vaping, you're mentioning different ways of doing it. Tell me, is it? And I'm a beginner, so I'm not knowing all of these different ways. Can you give me the brief 5 or 6 ways that normally people participate?
Sure. So like common methods of administration. Jessica, you have that conversation with patients all the time. Why don't you take that?
Okay, so your modes of administration. So there's smoking, which is either vaping, smoking, or bongs. So that's any inhaled method. You're going to have an immediate response, so it should kick in within 10 minutes. However, it's only going to last 3 to 4 hours max. If you take a capsule form can take up to an hour to kick in because it has to go through the liver and process, but then it can last in your system up to 8 hours max. Sublingually or tincture, whether you put a spray or a dropper under your tongue or mucosal back around your gums and your cheek and rub, that can kick in anywhere from 10 to 20 minutes and last up to 6 hours. So there's also a patch. You can put a patch on, and depending on where it is, if you put it on a vascular, kind of your hip over by your back right vascular area, that'll kick in quicker, and that can last up to 4 hours. You can do a salve. A salve will kick in immediately, and that can last, I say 4 to 6 hours because I've had some last longer, some not. It really depends on the product. What am I forgetting? Smoking, oral.
Suppositories.
That's the other one. So vaginal or anal suppositories, depending on certain patients have cancers, or I will have them do both. I will have them do an oral and a suppository, depending on like if it's a uterine cancer or what's going on, just to get to that area. And so some of those can kick in quick because it's a vascular area, so it can kick in faster and last about 6 hours. But usually it's best when you're going to bed because suppositories come out with gravity, so best to do it when in bed.
Yeah, people think it's a funny conversation. Well, and people laugh, but especially if you're working in the retail environment, we think it's important to talk about suppositories because, you know, you get over the giddiness or the jokes about, hey, don't bring this form to a party. It's not your best choice kind of thing. But the fact remains that if you're a cancer patient or if you're a patient has problems with eating disorders or any number of things you can't swallow, suppositories offer a high level of absorption rate of cannabinoids, and they also don't give you that full body high because that's because the THC is not passing through the liver. When it passes through the liver, THC becomes 11-hydroxy THC, and that's why if y'all have ever been high from edibles and like underwater high from edibles, you know it's a totally different feeling because 11-hydroxy THC is times more strong than THC is. So that's why it's, you know, it's good to pay attention, especially first time you do edibles, to your dosing. So
take quarter and wait, and then if it gets too high, you know, CBD brings down it stops that metabolization, that CPY450 enzyme, which is what breaks it down to 11-hydroxy THC. So if you take it with CBD, less high, or you could drink some orange or lemon juice to help bring that down too. So
And also they've shown that if you're going to consume CBD or even other cannabinoids, it's smart to take it with a meal, which
yes.
is counterintuitive to what you might think, because you might want to say, hey, I'll do CBD or whatever on an empty stomach. My body will be hungry for stuff. It'll make sure, but it's just not true. It's lipophilic, so it binds well to fats. So if you're going to have a nice fatty meal, doesn't have to be donuts. It could be avocados.
Yeah.
It could be a spoonful of olive oil in your salad or whatever it is. You're going to increase your absorption rate, and it's all about efficiency. Cannabinoids can be expensive once they're put into your products and stuff, and so so make good use of them. You know, like we're talking absorption rate and bioavailability. Those are important things as consumers to keep in mind, so you get the biggest kind of bang for the buck without getting too much.
Yeah,
Too
you want
much
to make it
effect.
last. They're
Right.
expensive. So I always tell people to take a fish oil capsule every morning. So those omega-3s, those are your fatty acids. I've had people tell me, well, I didn't feel it today. I'm like, did you take your fish oil this morning? No. I'm like, there you go. Get you. They
Good
didn't
call.
eat, they ran to work. Get that fish oil in the morning. That's, you know, it's
Mhm.
like you're taking your big spoon of oil, your avocado. That really emphasizes and boosts the efficacy of it, the way you feel it. So,
First time I heard somebody say that was a bud tender, and I thought they were full of it, honestly.
no,
I'm
they're
like, I
totally
looked at them sideways, and this is a while back. I'm like, I looked at them sideways, like, where did you hear that? They go, it's true. But I'm always questioning, I'm like, is it true, or do we all just agree that it's true?
yeah.
And so, and that's something we're going to encourage all of our students, y'all, to always double check yourself, because you might have heard something forever for as long as you've consumed, and it
Off.
might just be wrong. And so, especially for those of us who are representing retail, working with patients or some other, we want to get it right. And when you don't know, say you don't know, but
Yeah.
find out. It's
Go
an
look at
opportunity we should all be learning all the time, because there's more information coming out all the time. So
constantly. It's constantly having to study to keep up on everything. There's new data constantly coming out to keep up on all the different new cannabinoids. And yeah.
for sure. And people will be quick to say, well, there's not enough research. That's true,
Oh,
but
that's true.
there's more research on cannabis than most any pharmaceutical drug on the market, more than almost any herb that humans consume, except for maybe garlic. There is so much research. If you go on PubMed today and search under either cannabis or marijuana, you're going to get tens of thousands of responses. So it's not that it's not been studied. The federal government stood in the way of it studying beneficial effects. They were only allowed to study detrimental effects. So, and Chels, to answer your question, the recording of this, it'll just take me a few days. I will we'll edit it properly, put a bumper on it, and we'll put it on our YouTube page. So we encourage you to go to YouTube. We'll also put this in the pulmonary dynamics class, so it's bigger, part of the bigger whole. But yeah, we encourage you all, not just so we'll have followers, but we like to put stuff there. So as a student, you get first shot at it, but you can continue to come back and learn and refer people and all that good stuff. What other questions do we have?
I have a question, Trey and Jessica. It goes back to the temperature and heat discussion that you had a little earlier. And a few years ago, after an illness and a sabbatical, I bought a dry vaporizer and tried it and kind of started liking it for a while, but ultimately it wasn't the same experience, of course. It was different and so forth, and it's in a storage unit somewhere. But mainly, you know, I don't know, maybe different ones are different, but when I smoke a pipe or something, you know, I let it cool in my mouth. I take mini tokes, but when I would do that, you know, or a bong or anything else, you have to kind of go
Immediate.
you know, wholehearted with it. And my lungs didn't really like that as well. Any comments on that?
So you held the vaporizer or the flower vaporizer for a while in your mouth, like let it cool down, or
Well,
did you have a
to
controlled
get it
temperature on it?
going, well, to get it going, you know, I'd get it heated up and everything. And to get the smoke out of it, it takes some effort, you know, some inhaling, more so than say a pipe or even a joint, which I don't smoke
Yeah.
those anymore. And so with that little effort, I can hold the smoke in my mouth like we all used to do, and it cools, and then I bring it on in. But that was more difficult with the dry vaporizer for some reason.
Okay. Yeah, it is. I do notice with the dry vaporizers that you do have to do a little hole to get it to initiate through. I know they've gotten a lot better in the years with the different variable temperatures and ease of access of pulling it through. So I don't know what yours was specifically, but you still don't want to let it cool down. So usually when I have one heat up, I usually go about 380. That's a temp that I prefer, 374 to 380. I don't go above that. And it's, you want to see, so you want the smoke to be able to build up in there. So if it's a convection, depending on how it's heating it up, most of them are a lot of convection. So it's the heat around the flower coming through. So I do let it heat up. The one I have it lets me know that's warming up. And when it's actually ready means it's completely heated around, so that I know that there's actually smoke, so to say, to come through. But I do have to have a little pull. It's because of the narrowness of where it comes through from the flower to the mouthpiece itself. So that may have been where you had to pull, but I don't let it cool down. So do you know kind of how much I say dosing, I always fall back to dosing. That's a habit of dealing with patients, but what you usually like to take, like 2 or 3, how much would you smoke to get what you really enjoyed?
Yeah, probably 3, 3, 4 at a time. And then, later on again, but yeah, 3 or 4.
Okay. So you inhale it and hold it, and then immediately following inhale.
No, I'll put it down, and thank you for the information, because, about the holding thing, the 3 seconds thing. Yeah, I didn't know that. But no, usually like I'll do one and put it down and fiddle with something for a few minutes, and another one, and a total of maybe like 4 and 10 minutes. And then,
okay. So sometimes I notice if you do put them down, and I don't know if yours has, like, if the lid closes or if it stays open so that room air can get to it, like to cool it back down. So mine, can I show it, Trey? Is that okay to show?
Oh, of course.
Okay, so mine has a, I don't know if you can see it, but you can do the numbers here, but the mouthpiece folds in and out. So if I'm not using it, I close it so that heat stays inside, because the flower is actually down here, and it goes through a little hole to get up to come out here. And I do have to pull to get it to come through it's a narrow, so you got a little resistance going through that narrow line right here. But I do close it so the smoke and the heat stays in, because if it's open, it's going to cool down. And so you're actually losing that controlled temperature while it's sitting there.
Right.
So it's best to have one that closes so you can keep the temp inside. And this one you can set the I'll show you the temperature. You can control the temperature, and then it tells you, if it's heating up and where it's at.
Yeah, they've come a long way, obviously.
So that's a big part, is making sure it's closed, because when you set it down, and if it's a cold counter, like say you have marble or whatever, your kitchen counter, it will cool down the whole unit. So you really got to make sure whether you're holding it, that it's closed, or where you're setting it down can actually change the temperature differential inside. So those are things to be aware of.
And I'm really glad that you showed it, so people get an idea of how portable they are. You don't have to spend $400 or over $400 for a volcano vaporizer with the turkey bag and all that anymore.
No.
There's a product called PAX also. PAX has made a good presence in the market. They've got a product that I think is about $150. You can spend a lot more than that if you want, but that'll allow you to, has more limited settings than what you showed. But what you want to look for, I've gotten a vaporizer before that had an open coil, and it basically was still burning the cannabis. And so that defeats the purpose. So make sure that the oven doesn't have any exposed coils. It also makes it easier to clean. So when you clean, and like you've mentioned, make sure you're not going to all this trouble to buy great material, clean, great device, clean weed, and then turn around and clean with something that's gross. So isopropyl, if you're going to use it, as high percentage 99. If you can get it, we use Everclear. I want a food grade cleaner, and Everclear we don't drink. That's the only alcohol I buy. But Everclear cleans up pretty well. Still has, kind of rinse it, make sure it doesn't have that residue. But
and this is, when I talk about convection heating. So can you see the inside? So it heats up all around. It's not a coil, so you're not burning and you don't know what your temperature actually is. So I prefer convection, and
well, thank you for that.
That helped a little.
And to respect everybody's time, want to say we're right at an hour, and we're really grateful that all y'all could join us tonight. it's nice. It makes for a more dynamic conversation, and we hope you're always learning. That's why we exist. That's why we started doing this. Now it's like 6 years ago, and so it's exciting. It's really exciting to be in this space, and it's nice to have y'all along for this ride. Everybody's on the same ride, and cannabis is the most diverse community you can belong to. So we want to always reflect that and being inclusive and remembering our brothers and sisters who are still in jail tonight for doing the same thing that people are making a living off of today, and for doing it on a much smaller scale. Nonviolent offenders still in jail. So Last Prisoner Project, keep them in mind. LPP is a great organization that we're happy to partner with, and we'll talk more about that later. But refer to your overall chat schedule. We'd love to have you all back for more chats. There's several more this week. Like I mentioned, Cooking with Mary White tomorrow. Vic, Cannabis Reverend there on the call with us, will be on Thursday night at 6. And then Jeff Freeman, the owner of Infused and Polite Brands Cannabis, he's bringing cannabis into the hospice space along with his teammates and some of our mutual friends. So bringing cannabis to hospice patients so that they can enjoy the benefit too. So he'll be on Saturday session at noon. All those links are in your in the materials we sent out. If you ever need to reach me, this is my email, treyreckling@gmail.com, just because that's easy to remember, fairly easy to remember. And thank you, Jessica. Thank you for your time.
Thanks for having me.
Oh, absolutely. And thank all y'all. We look forward to seeing you on the next chat.